Yes. Now come to Vataja Kasa. Treatment of Vataja Kasa. Okay. I told the severity increases with the stages. Vataja Kapha means less severe actually. All the symptoms are more. Discomfort caused to the patient is more, because we know that when the cough is more, patient is safe but discomfort is there to the cough. Therefore, mother is worried. Okay. But actually patient is safe. Therefore, Vata Jakasa is less severe actually. Pitta Jakasa is more severe and Kapha Jakasa is still more severe. Or severe in the sense dangerous. Okay. Now we see first Vata Jakasa. And if you look into the symptoms which are mentioned in case of Vata Jakasa, there is pain in the chest area, there is pain in the Kanta Pradesha, pain in the neck muscles, pain in the back. Okay. Hrit Kanta Parshva Ruja. Okay. Pain because of, see, it's a severe cough, no? Severe cough. And because of severe cough, there is so many muscles are get involved there, and that leads to cough because of continuous coughing. Although cough is not dangerous. Cough is not dangerous, but still, because of that continuous severe coughing, there is more pain. Therefore, Ayurveda very clearly says Hrit Kanta Parshva Ruja and Shirashula. Sometimes also there is headache, and it's an irritating cough. There is no sputum. Okay, there is no sputum. Ayurveda says that the very less sputum is alpa sputum is formed. Okay, but the pressure increases are more, pressure changes are more because of severe cough. Okay, therefore muscular work is more, and therefore child has got more discomfort. Okay, more discomfort. But still this Vata Jakasa is basically not dangerous, because we know that severe cough is always not dangerous, because disease is still in the upper airway, disease is not in the parenchyma. Okay, so therefore see, although here severe cough is there, he is not mentioned about Jwara, because severe cough when happens, what is the most common cause for the severe or irritating cough? That is allergies. We know that in case of allergy, always the cough comes first and fever may come later or may not come. Isn't it? But if it is a bacterial infection, fever comes there, fever is going on increasing, cough is very little in case of tonsillitis, bacterial tonsillitis. In case of viral, fever is there in the beginning, and once the fever comes down, then the cough starts. Fever and cough both are not existing for more time. Therefore, when I say Vata Jakasa, for the practical purpose, in 95% of the cases, it is related to allergy. It is nothing but allergy. Okay, it may be atopic allergies or non-atopic allergies or any other type of allergies. Okay, IgE mediated. Okay, so but it is a type of allergy, because only in case of allergy we will have the severe cough, and sometimes post-viral cough. That's all. So, what should be your treatment? Treatment is again, it is Vata Jakasa, therefore it is Vatahara treatment. Vatahara treatment should be given. Okay, what is the best Vatahara we have? Madhur Rasas are considered as best Vatahara. All the Madhur Rasa drugs are considered to be best Vatahara drugs. Okay, so now this Madhur Rasa, actually what it will do, it will protect the barrier of the mucosa. It will form a coat over the mucosa, and it prevents the further injury by the allergic substances to the underlying mucosa. Okay, for example, you go for Sitopaladi Churna. Sitopalaha Shodasa Syat. Madhur Rasa Pradhana drug it is. Okay, and therefore it will do the function of protection of the respiratory mucosa, and further irritation and further stimulation will be prevented. Okay, next you go for the soothing agent. Now go for Esti Madhuchurna. Okay, Esti Madhuchurna is a Kantya, it is Varnya, and it is also Kapha Chedana. First it initially increases the cough, then it will omit out the cough. Kapha Chedaka it is. Okay, it is also Madhur Rasa drugs. Again Vatahara. Now, then if you want any Tailas you can go for Inimedadi Taila and even Tila Taila. Okay, among the Vatis you can go for Kadiradi Vati. It is also doing the soothing action. It counteracts the irritation. Okay, now other medications which can be given are Snehana, Swedana, then Ushna, Avagaha. All these are Vata Nomana treatment. This can be done all over the body, Sarvadaika, or it can be also localized. Okay. Now, Vata Nomana treatment should be given Now, Apanavata is taking a wrong direction. It has to be normalized. You can also go for Pratimarga Harana Chikitsa. Actually, Pratimarga Harana Chikitsa is for the Pitta. We know that. Okay. But here also you can give the simple Avipatikara Churna, etc. So, which corrects the normal bowel movements. Okay. And that also helps to correct the direction of the Apanavata. Okay. Now, usually in the contemporary science, they go for the anti-tussive agent. Anti-tussive agent, which suppress the cough center. Okay. If cough is more irritative and not under control, then only you have to go for the anti-tussive agent. Otherwise, according to the principles of Ayurveda, Kasa Vega should not be inhibited. Okay. You can relieve the discomfort by giving some of the sedatives. Just go for the sedatives of the patient. The discomfort will be relieved. Anyway. Now, if you want to give some of the anti-tussive agent in case of irritating cough or dry cough, etc., again go for Vatahara treatment. Okay. So, again go for Vatahara treatment by inducing the cough center inhibition action. So, some of the drugs which are having mild sedative action like Badari, maybe Kola, then Shati, and sometimes simply Ahifenasava, 2 or 3 drops in infants, that also gives a very good results. Okay. So, that also gives a very good result. Snehika Dhumapana can be also done in case of allergic cough. Snehika Dhumapana can be also done. So, this is a protocol for the treatment of Vataja Kasa. Okay, I don't say that you have to use the same drugs. That depends upon you and different physicians. Okay, now, but this protocol has to be followed. We should not go for excess or unwanted treatment in case of Vataja Kasa. All those symptoms are very severe. I do agree. Okay, that's the nature, isn't it? Symptoms will be very severe, but still I assure that the patient is safe. Because severe cough is not dangerous. Okay, so don't go for unwanted treatment. If you go for unwanted treatment here, then the cough will get complicated. Okay, you go for some Tikshna, Ushna drugs. There is no formation of the sputum, but you are giving some of the medication to remove the sputum. Unwanted. Okay, and there is no fever, there is no infection, and you are giving drugs for the infection like antibiotics and all. Okay, no need actually. It's considered over treatment. That itself complicates the condition. Okay. Now, there is one more variant of Vataja Kasa. Now, sometimes Vataja Kasa has got one variant. Sometimes Vataja Kasa may be there with some involvement of Pitta. I clearly told you, Vataja Kasa maximum condition is nothing but allergic conditions. Okay. Allergic causes of the cough. Sometimes this allergic Vataja Kasa may be associated with Pitta. Okay. So, irritation of the mucosa is there along with the burning sensation. And patient is also feeling some feverish. This is usually, I told, in allergic conditions, cough comes first, fever comes later. Okay, sometime in the later part, it may be involved with the Pitta. Okay. So, then what you will do? You have to go for Vata Pittahara Chikitsa. Vata is main, then Pittahara Chikitsa. So, some of the Grita preparations can be given. For example, Rasna Grita, Kantakari Grita. Okay, to subside the Pitta, you can go for some of the Grita preparations here. Another variant of Vataja Kasa is, see, when Vataja Kasa is with Pitta is there may be some skin rashes also. Okay, there may be some skin rashes also. Usually, a patient of allergy, so he may manifest with the respiratory allergy, along with sometimes he is also manifesting some of the skin allergies. You know, skin may be rashes वगैरह आता है. Okay, so that time you have to understand that this is nothing but Vataja Kasa with the Pitta, associated with the Pitta. Go for some treatment of Pitta. Just go for Avipatikara Churna, no problem. Or maybe Kamaduga Rasa. Take urticaria like lesions with skin mein ho raha hai. So now it is association of Vataja Kasa along with the Pitta. Sometime Vataja Kasa may be there with the Kapha. Okay, instead of Pitta there is Kapha. So here what happens? Patient has got irritation and severe cough. Along with that, he is also having loss of appetite and heaviness of the head. Okay, and heaviness of the body also. Okay, see in Vataja Kasa, although he has got such severe symptoms, there is no loss of appetite. That means patient is okay. Okay, symptoms are very severe there, but still there is no loss of appetite. Okay, but sometime Vataja Kasa may be there with the loss of appetite. If it is loss of appetite is there, then there is the involvement of the Kapha. Now you have to go for Vata Kaphara Chikitsa. Now Chitraka Dileha, Agastya Haritaki Leha, Kantakari Avaleha, etc. should be used. So these are the two variations sometimes that we can see in case of Vataja Kasa, allergic conditions. Okay, and if it is because of kapha, then some itchy sensation will be also there. Patient is may have formation of some of the sputum, some amount of sputum, okay, and some itching sensation may be also seen, or in the skin also sometimes there may be itching sensation. Anyway, so this is the treatment of Vataja Kasa and also associated Vata conditions. Okay, now what is the take home message? Take home message is there is no formation of a lot of sputum in this case. It is allergic conditions. So dry cough like conditions are there. So don't treat it unwantedly or unnecessarily. Over treat it. Don't over treat it. Okay, number one. And Vataja Kasa should not be treated with the Tikshna Aushadhi. For example, sometimes when you don't know the diagnosis, Kasa is there, you will go for Pipali Churna. Okay, because you think that will clear the cough or sputum. Okay, Tikshna Aushadhis will go for Trikatu. There is no need of Trikatu because there is no formation of the sputum. What it will do? It will cause further damage. Okay, it will cause further damage. So don't go for Tikshna Aushadhis in case of Vataja Kasa or allergic conditions. Okay, so in the contemporary sense, usually early antibiotics and they are causing much damage. Okay, so don't go for unwanted medication. So simply Kadiradivati can be given, and this Maricha preparation and Vyoshadivati, actually these are not useful in case of what you say Vataja Kasa. It may be useful in Pittaja or Kaphaja Kasa, it's a different issue, but in Vataja Kasa, allergic cause, it is not the right medicines. Okay, best is Yashti Madhu. Yashti Madhu is Madhura Rasa and it is Kanthya, it is Kapha Chedaka also. If at all the sputum comes, that means in dry cough, what Yashti Madhu will do is, first there is a dry cough in Vataja Kasa, so after administration of Yashti Madhu, it increases the sputum amount. It increases the secretion of the respiratory mucosa, and once the secretion of the respiratory mucosa increases, the irritation comes down. And later the sputum will be expelled out. This is a beautiful nature, beautiful action of the Yashti Madhu. Yashti Madhu is Kapha Chedaka also. Therefore, Yashti Madhu Churna is the best medicine in such conditions. Okay, if it is not working, then you go for the next medications. Okay, so this is how we have to treat the Vataja Kasa. The next portion we will continue in the next class. Okay, so today we will stop.